Hi everyone, it's Lisa Moeller with MedMark and welcome to DocTalk Dental. We are joined today by endodontist Dr. Martin Levin. Dr. Levin is in private practice in Chevy Chase, Maryland, limited to endodontics. He is the chair of the Dean's Council and adjunct professor of endodontics at the University of Pennsylvania School of Dental Medicine, where he also attended. He served as co-chair of the American Association of Endodontists and American Academy of Oral and Maxillofacial Radiology Joint Special Committee of the use of CBCT in endodontics in 2010 and recently served on the Update Committee. He is a contributor to endodontic textbooks and author of numerous peer-reviewed articles and is a diplomate of the American Board of Endodontics. Welcome, Dr. Levin.
Yes, thank you very much, Lisa.
Thank you for joining us today.
You're welcome.
We're so happy to have you.
My pleasure.
So tell us how you chose the specialty of endodontics.
Well, that's really a good question, Lisa. The things that I find most appealing about endodontics are the technical challenges, treating pain, and managing medically complex patients, and of course trying to improve endodontic outcomes. So it's been a journey, and I've enjoyed being a part of this journey during my career.
And how long have you been in the field of endodontics?
40 years.
Oh my goodness. Wow, that's amazing. Well, you're very well respected in the industry.
Well, thank you.
I know this. So you purchased the first limited field of view CBCT in the U.S. Why did you then start conducting seminar training programs on this subject?
Dr. Barry Pass, an oral and maxillofacial radiologist, and I began the seminars to teach about 3D interpretation, ionizing radiation, and the physics of image generation from an interdisciplinary approach. We found that the exchange between endodontists and oral and maxillofacial radiologists has been very helpful to our colleagues in both fields.
How does the CBCT aid in diagnosis as an endodontist?
Well, 2D projections suffer from 4 inherent limitations that may mask endodontic lesions, namely compression of 3D structures, geometric distortion, misrepresentation of structures, and magnification error. Perhaps the most important advantage of CBCT in endodontics is that it demonstrates anatomic features in 3D that the intraoral and panoramic images cannot. The units reconstruct the projection data to provide interrelational images in 3 orthogonal planes, the axial, coronal, and sagittal reconstructions. And in addition, because the reconstruction of CBCT data is performed on a PC in the office, the data can be reoriented in real time, and we can better understand the true spatial relationship of the areas of interest. CBCT is the first clinically practical technology demonstrating the application of 3D imaging for endodontic considerations. I mean, let's face it, we're dealing with 3D patients with 3D features. And to use 2D imaging in all of these assessments leads to many lesions that are not detected.
Right.
Yeah.
It really is a must-have technology in endodontics these days, wouldn't you say?
I think it's essential. And while I don't use it on every case, and in looking at the use in my practice, approximately 58% of patients who appear for a consultation are going to then undergo a 3-dimensional imaging procedure.
Right.
So it's not on every case, and we have to take into account the guidelines that we're going to talk about a little bit later.
Great. So tell us about some of your memorable clinical cases that you've had recently.
I brought a few examples along to demonstrate. In this initial intraoral radiograph exposed with an RVG 6200 sensor, the mandibular right first molar shows previous endodontic treatment. The only hint of a lesion is the slightly irregular trabecular pattern associated with the distal root, but no associated discontinuity of the periodontal membrane. The next image is a Carestream dental generated CBCT sagittal reformation showing a circular, well-defined area of low density with a mildly corticated border centered over the furcation, measuring approximately 11 millimeters, features consistent with a radicular cyst or periapical abscess. The coronal reformation in this next slide shows a missed distal lingual canal. The true nature of the apical periodontitis only becomes apparent after the viewing of these CBCT images, so immensely helpful in diagnosis and treatment planning these cases.
So would you say that you use Carestream Dental exclusively for your CBCT in your practice?
I do.
Okay. They're an amazing company. They really are. You've been using limited field of use CBCT and endodontics for about 10 years now. What is the current adoption of this technology by endodontists in the U.S.?
Well, that's a great question, because there was just a paper published in the Journal of Endodontics by the group at Penn showing that 80% of endodontists had access to a CBCT scan, of which 51% were on site. Only 19% of all respondents denied having access to CBCT imaging, a rather remarkable adoption of this technology in my view.
That's great. So tell us about your passion outside of your clinical practice. What do you do in your spare time?
How long do you have?
You are a busy man, that is for sure.
I like to do things. So conducting seminars over the past 8 years that have trained more than 350 endodontists in the use of CBCT has been very rewarding. And we've established to do this, we've established the CBCT Learning Center for Endodontists. Also, for the past 3 years, working with the anthropology team at the Smithsonian Institution, Jamestown Rediscovery, and Virginia Commonwealth University to study the skeletal remains of the first settlers to North America. This has been a project of enormous interest to me and has involved a team of about 30 scientists. In fact, Carestream Dental has been very generous and loaned imaging equipment for use at Jamestown for some groundbreaking new imaging documentation. The CS3600 intraoral scanner was used to image individual bone fragments to help reconstruct the cranial base. We're very interested in putting these STL files together via an algorithm so that we can understand better the shape of the cranial base, which was in 64 pieces of bone, actually.
Wow,
yeah.
That's amazing.
Lastly, working with the Image Gently Alliance, a coalition of more than 80 healthcare organizations dedicated to providing safe, high-quality pediatric imaging worldwide. The primary objective of the Alliance is to raise awareness in the imaging community of the need to adjust radiation dose when imaging children. And I find this is a very important subject because so many of us in dental practice use the same imaging parameters for children and young adults as we do for older patients. And that needs to be looked at.
Absolutely.
And it's a matter of training. In fact, there's a great website. The Image Gently Alliance is a great website which speaks to this subject, and I think it's very useful to visit.
Absolutely. I'm sure our viewers will check it out. It's a very important topic, being able to treat children properly with the right amount of radiation, definitely. I hope you'll come back and talk to us about your Jamestown work again and keep us updated with that.
It would be a pleasure.
A very, very important project.
Be a pleasure.
So you were co-chair of the AAE and AAOMR Joint Special Committee on the Use of CBCT and Endodontics in 2010 and recently served on the Update Committee. Please describe 3 best practices from
pleasure.
Matt.
Use intraoral imaging for all initial pre-treatment and post-treatment imaging, except in some trauma cases where intraoral radiography is problematic. Number 2, depending on the equipment used, CBCT exposure may subject a patient to only slightly higher radiation doses than conventional 2D imaging, or considerably more. So it's important that clinicians follow professional judgment in minimizing the radiation dose to the patient, to that deemed essential to optimal diagnosis and treatment guidance. To the extent practical, the field of view should only slightly exceed the dimensions of the anatomy of interest. For example, if you're imaging only one tooth, do not expose a medium or large field of view scan. And of course, always follow the Alera principle, as low as reasonably achievable. And finally, number 3, to summarize the recommendations of the AAE and AAOMR joint position statement, consider using CBCT for diagnosis in patients who present with contradictory or nonspecific clinical signs and symptoms associated with untreated or previously endodontically treated teeth, difficult morphology, for localization of calcified canals, cases where intraoral radiography are inconclusive in the detection of vertical root fractures, non-healing of previous root canal treatment, complications such as separated endodontic instruments, pre-surgical treatment planning, implant planning, and dentoalveolar trauma where a root fracture, displacement of teeth, and/or localized alveolar fracture has occurred, and lastly in resorptive cases. So I think that pretty much summarizes the joint position statement, and I think it's worth the time for every endodontist, especially that's using CBCT in their offices, to download this from the AAE or the AOMR websites.
Okay.
At AAE.org or AAOMR.org. And
yeah, we'll give some more information on our liner notes.
Great. And you can put a link in, I'm sure.
Yeah, for sure. Well, you do such amazing work in the field of endodontics. I want to thank you so much for joining us today.
It's been a pleasure.
It's been a pleasure sitting down with
Thank you.
And I'd also love for you to contribute some articles to endodontic practice as well, and share the information through our publication.
Be happy to do it.
Thanks so much. We look forward to seeing you again soon back with us. Take care. Thanks so much for joining us today on this special edition of DocTalk Dental. I'd sincerely like to thank our special guest, Dr. Martin Levin. For more information on where you can find his courses, please go to endonet.com. And a huge thanks to our sponsor of this episode, Carestream Dental. For more information on Carestream Dental, you can find them online at carestreamdental.com. As always, for more info on everything endo, please go to endopracticeus.com and subscribe to our publication. We look forward to seeing you on another episode of DocTalk Dental, and we'll see you soon. Thank you.